course information. As you know, I'm Kardo Mohammed Faraj. I am internist physician, and I've been giving a lecture about health psychology for about 2 years in this university. And I hope you have some information about the health psychology. Any idea about health psychology till now? Do you have any idea? Have you heard this? Anyone? Okay. Let's start with this course information regarding the course. The screen is clear?
Yes.
Okay. And now you see the course information?
Yes.
Okay. So this is our course, as I said, health psychology. I think you are third semester, right?
We are the third one.
Third one?
Yes.
Yeah. Okay. So this lecture has 3 credit. The total duration may be 17 weeks or 14 weeks. And the topic, it is 12 topic regarding the topic, 12 lectures. And we have 2 assignments. The first one is reporting. You should have a report and submit it in the 5th week. Okay. And you can make yourself a group of 3 person, 2 person, no problem, but not 4 and 2 to 3. Okay. And try not 5 person and so on, especially for the reports. And the report should be on the subject of the health psychology. You can search any object regarding the health psychology. You have done report before?
Yes, we did a lot.
Okay, okay. So you are familiar with how to write a report. Okay, so the report should be submitted in the 5th week. Okay, the deadline 5th week. Later on, I'll add the assignment in the Moodle. And the second assignment after the midterm in the, I think, 13 week, it is a presentation. Okay, and the presentation should be about the personality. Okay, each one presenting a topic about a personality, like personality type A, type B, antisocial behavior, and so on. So there are so many personality in the health psychology, in the psychology. So you should present a topic about a personality, and you should submit in the 13 week. Clear till now?
Yes.
Okay. بس تو وەڵامی تو بەس تۆ لە سەخەتی مایکەکانتان بەکار بێن بۆی بزانین لێرەن لێرە نین باشە so and this is the content of the our lectures. We have 12 topic. As I said, the assignment 1 in the 5th week, and try to stick to the time because we had some problem before. They delayed to submit the material, so try to not have a delay, okay? And the midterm, you know, in the 7 and 8 week, during the midterm also we have a lecture. In the 13 week, we have just seminar presentation. We have no lectures. We finished the lectures. Okay. And this is the textbook, our reference for this lecture. And it is mandatory. You should have information about this textbook. I uploaded already and recommended by Mara University. And regarding the assessment, all of you know about the assessment. We have the test and the continuous assessment. The tests, we have midterm and final. 20% for the midterm and 40% for the final, and the assignment 50% for the assignment number 1, which is a report, and 25% for the assignment number 2, which is 25%. It is clear? And to enter the final, you know, you should have more than 50% of the total. So this is all about the course information. Any question till now about the assignment and the course information?
No, thank you.
Welcome. So now we will talk about and discuss the first lectures. سوري بس شاني بزانم مودريتكا شتينا دوات زۆر باشە. تا ئێستا هەمووتان لەسەر خدماون؟
Yes.
دەی هەمووتان بڵێن یەس کاکە بە بەڵێ
بەڵێ کاک دکتۆر.
Yes.
لي زۆر باش
Yes, دكتور.
بەڵێ هەمومان لێرەی.
لي زۆر باشە 20 کەس لێرەن
Yes.
وەزان تەواوەتە زۆر باشە دەی طبعا ئۆنلاین سەموت بۆرینە وەکوۆنی ئینتەراکتیڤ بێت و لە ناو کلاسە بەڵام چی بکەین تر سیتوێشنەکە وایە اوكي so the slide is clear.
Yes.
Okay. So the first lecture is about what introduction to health psychology and definition of the health psychology. This is the content of our lectures. The first one is introduction to psychology, health psychology. The second topic, change in field of health and psychology involvement in health. Why we need health psychology? What is the significance of the psychology? And epidemiology, and the last one, what is the work of health psychologist? So the first one, regarding the introduction, this is the general objective. You can read later for yourself. And at the end of the lecture, you should be learning this. At the end of each lecture, you should have a learning outcome. What you learned from these lectures, okay? So this is for yourself. I think all of you familiar with the Bloom taxonomy, isn't it? Have you anyone till now not heard about the Bloom taxonomy?
I don't think so.
Oh, so you should read about the Bloom taxonomy. What is the Bloom taxonomy in the learning outcome? It has level. First, remembering. You should remember the lecture. After that, you will go to the level up. You should understand what you have in the lectures, not just remembering without understanding, okay? And then you should apply this information in the real world, and you should have a skill, analyze the situation, analyze the problem. And you should have that skill, evaluate. And then you should be, the last one, we want from you, creative. You should be creative, okay? And now definition. What is the health psychology? Have you anyone heard before this lecture about the health psychology? Before this course and semester?
I know it's in general.
Okay.
So I think it's like we study about the health, emotionals, and behavior of ourselves.
Okay.
Yes, that's what I know.
Okay. Any person, any other student have any idea about health psychology before? Okay. So health psychology, it is a link between the biomedical problem and the psychological problem. So it is devoted to understanding psychological influence on how people stay healthy. And we have a question, why we become ill? And when we became ill, how we respond to this illness. So it is applied psychology concerned with what? And I'm getting with psychological aspects of physical health. So it is talking about psychological effect and impact on our body, our physical health. So health psychologists study this issue and try to create and develop what intervention to help people stay in a good condition and stay healthy and to get rid from the disease. So, for example, we have a question. Yeah. Some researchers want to explore why people continue to smoke. Even most people know that the smoking is dangerous. Isn't it? Is there any smoker? Hashtag بخسناكن, huh? So, it says زوربي مودي فيبو أمشتانية. Anyhow, all of you know the smoking affect our health. In spite of that, most people continue to smoke. So the health psychologists try to find answer for this problem. So if you understand this, you can do intervention to help people stop smoking. So health psychology is a specialty area that focus on what? Be careful. How? Biology, psychology, behavior, and social factor. All, not just one factor. Biology, psychology, behavior, and social factors. How these factors influence our health and illnesses. So the specialty of health psychology in this field. Integrate all these fields together. Okay? And we have a behavioral medicine. Study the behavior of a person, how our behavior has impact and effect on our health. Now, you will try to have a definition of what? Health. Tell us about the health. What are the health by you? What's your opinion about health? Any idea?
I think it's like we have to do an exercises or eat a healthy food and take care of ourselves.
Yeah.
Yes, that's
And what
it.
is called health, healthy person?
Our health in general and everything. Our body,
Everything.
our mind.
Okay.
Yes.
Okay. Sorry, your name?
Tuqa.
Tuqa. Very good. So, what is health? By WHO, the definition? A complete state of physical. Look, physical, mental, and social. It is not just complete state of physical healthness. 3 dimension: physical, mental, and social well-being, and not just the absence of the disease or infirmity. So, Kawata, definition complete state of physical, mental, and social. You should have healthy in these 3 dimensions. If one dimension or one aspect, you have a problem, so you are not healthy. So complete state of physical, mental, and social regarded as a health definition. So, and wellness in another world refer to this optimum state of health. يعني كاتي ويلي ككاتي optimum state ام dimensionانها بأم aspectانها بكباس مانكر. So, أما definition WHO بيوكو خوي بيزان and it is very important. نزيشي ميتيرم مەڵێن چی گرنگە و چی گرنگ نییە. ئێستا لە کاتی لێکچەرەکانە زۆربەی کات مێنشنی ئەەکەین. لە کۆرس ئینفۆرمێشنەکەی ئاوازان باسی ئەومان نەکرد. ئێمە عادەتەن زۆربەی کات میتێرمان هینە true false لەگەڵ multiple choice questionە ئیتر جاریە 50-50 70-30 بەو شێوەیە باشە بەڵام لە فاینل تست جیاوازترە true false وینمان هەیە و بەڵام enumerate و هینیشی تێکەوێ کەیسوانی تێکەوێ لەبەرەوە ئاگدار بن ئەنجا عادەتەن سعی بۆ multiple choice تۆزێ ئەبێ ورد بن زۆر جار هەندێک تێرم هەیە بە تەواوەتی شتەکە ئاگۆڕێ common uncommon always ئەمانە زۆر لە multiple choice ئابێ وریای بن so ئێستا ئەگەر بۆت بێتەوە بڵێ the definition of the health by WHO is a complete state of physical health or well-being. It is true?
No.
No. So all of them. Okay. Now, area of health psychology. The health psychology try to do work in the following area and specialty. First, prevention and treatment of illness. What is the prevention? Any idea? And especially in medicine, we have primary and secondary prevention. Any idea about prevention?
It prevents ourselves from sickness, like
so you have
viruses.
no disease. You
yes,
have
no disease. Yes.
Try to not get a disease.
Yes.
And you have a primary prevention, just for general information, when you have not heart attack, try to prevent heart attack. While secondary prevention, what is the secondary prevention? You have got heart attack or stroke and try to not get again these attacks by some measures. So the prevention, the main area of the health psychology is what? Prevention. You should manage the health behavior of the people to not to get the disease. Tell the people, change your behavior. You have a sedentary lifestyle, always sitting, always sleeping, not doing any exercise, anything. So you should do exercise. You have a healthy diet to not get obese. If you get obese, you may get a list of medical disease like obstructive sleep apnea, diabetes, hypertension, cardiovascular disease, and so on. So the most important thing is prevention. الوقاية خير من العلاج. هم تابستوتانا. الأواني كله شون. Till now, all of you online?
Yes.
جارا سری کشکینو باش. Anyhow. And the second area is what? Etiology. What are the etiology? Do you have any idea about it?
The study of cause of the disease, like environment or genetic.
Yeah, very good, very good. So before going to the etiology, after the prevention, you know, treatment. What is the treatment? When you have a disease, you should treat. Okay. We have pharmacological management, we have non-pharmacological management. So regarding the etiology, study the cause of the disease. Why did this disease occur? For example, infection. This is one of the cause of the disease. Due to what? Due to virus, bacteria. And why this virus occur? Due to the changing of the environment. As you know, some virus is a seasonal. In some season you have influenza season, flu season. In the hot season, sometimes you have the gastroenteritis problem. And especially cholera, we have at the end of the summer, most of the time, there are cholera outbreaks sometimes. Why this cholera occur, and so on. Why people have cancer, what are the risk factor and etiology of the cancer. So they try to find the cause of the disease, especially in the psychological aspects. So health psychology try to find and to work in this field. We have a definition of the health psychology by Matarazzo. He's a psychologist, and this definition approved by American Psychological Association in 1984. What is the definition? The aggregate of the specific educational, scientific, and professional contribution of the discipline of psychology. Why this? To promote and maintain of health and to prevent and treatment of illness, and the identification of etiology and diagnostic correlate of health, illness, and related dysfunction, and to the analysis and improvement of the healthcare system and health policy formation. تقريبا definition كامواني كباس مانكر كوي كردوتو باشا كواتا ام definition انا بيوكو خوي بيزانن اوان يبلي تو زين دياكي شتيكا مشتيجي ستاندرا قسەی خۆمان نییە ینی تۆ دیفینیشنەکە دانراوە و ئەپڕۆڤەڵی لەسەرە کوتم تۆپیکەکەی هەمووی کۆ کردوتەوە ئەم دیفینیشنە. Is it clear?
Yes.
Any question till now? Any problem till now? Do you have any issue?
No.
Okay. چەند کەس خەویەتە ئێستا؟ باش هەمووتان ئەوێرن ئەو بۆ جەجار تۆزەینەکاکەین بۆیە ئەوێرنەستان بەرزکەینەوە و خەوتان لێ نەکەوێت. باشە گیان؟ باش. Now, in summary, health psychology examines the psychological, as I said, social factors that lead to the enhancement of health, the prevention and treatment of illness, and the evaluation and modification of health policy that influences healthcare. Now, what are the aims of health psychology? The first aim, health psychology, is try to understand, explain, develop, and test theory. So try to assign a theory, a test theory, to find the resolution for some problem. So, for example, you have some theory about the behavior, evaluation of the role of the behavior in the etiology of the illness. Why some behavior causing some medical diseases. And if you change this behavior or fix this behavior, the person will become better, and the health psychologists try to find answer for this. By what? By developing a theory. So and try to predict what unhealthy behavior, and then evaluate what interaction between psychology and physiology. For example, when you become afraid, what will happen to you? Any idea? If any physiological reaction to a threat by you? Have you ever experienced this? Any idea? If you have a threat,
No.
if you have a threat from something, what will happen to you? What is the physiological reaction?
If we have something for what? About what, يعني?
Any threat. You are afraid from a subject, a things. What physiological reaction will occur in your body?
Maybe sadness or would be
Physiological.
angry.
Physiological reaction. Do you know what is the physiological reaction?
Yes.
What will happen in your body, to your body?
I don't know.
Anybody?
I
Your
didn't
blood
get it.
pressure is changing,
Yeah. What else?
and then when your
heart
heart
rate.
breathing is changing, your breathing is
Yeah, very good.
and I don't know also.
What about the
heart-
pulse rate?
The heart rate increase and
Yeah.
the breathing become faster, and the blood pressure raise.
Yeah.
Also, the muscle become tense.
And you'll get shaking, tremor.
Is it like the
And-
panic attack?
Yeah.
Uh.
Yeah, panic attack is a threat. It's you are afraid from something. You have phobia. Okay, so you'll get also sweating. Okay, so the health psychology try to evaluate this interaction between our psychology and our physiology. Okay, كواتتو psychology كتشيبو ثريتك ابو بونمونا هيلا فوبيا هيلا شي لا انيمال بشي ليه قبينه reaction يبي a big sound sometime or a darkness. This is the psychological threat. And the physiological reaction, as you mentioned, why will this occur? So, and later on, try to understand the role of psychology in experiencing of illness. Is there any role when a person have a cancer? Is any role of psychology if a person have cancer? Yes, it is very important. So, and also evaluate the role of what the psychology in the treatment of illness. You know, some patient, if they have a diabetes, you should convince him or her to use their medication. So there is a psychological role in this matter. نتم بیستو کەسێ جارێ ڕەفزی عیلاجەکاتەوە نەخۆشە کانسەری هەیە ئەڵێ من خۆ هەرە مرم بۆچی ئینکەم ئەبێت تۆ قەنەعەتی پێ بکەی کە هەندێک کانسەر هەیە چاکە بێتەوە کەواتە ڕۆڵی سایکۆلۆجیست هەم لە پریڤێنشنا هەیە هەم لە تریتمنتا هەیە ئەیمێکی کە چییە health psychology aim to put theory into practice. ئێمە بۆچی theory خوێنین؟ خۆ theory بەس بۆ نایخوێنین هەر بیخوێنینەوە تا بڵێنەوە theoryەکەی بۆی practiceیکەین. Is this theory applicable? Can you implement in real world this theory? If you cannot implement a theory in the real world, so you must change the theory. What are the fault of this theory. So our role as a health psychologist to implement theory into practice to change the standard of care and to make the people live healthier. This is for promoting healthy behavior and preventing of illness. So the second topic, this is all about the introduction of health psychology. Now, the second topic, changing field of health. As you know, there are so many change in the field of health from the beginning of till now. There are so many development in the health. Previously, we had a biomedical model. What is the biomedical model? They believe that the disease is due to the organic one, due to a bacteria, a virus. It is the psychology. They believe that the psychology and the behavior has no role in developing the disease. This is called biomedical. So if you see the name of the model, there is no psychological or social, called biomedical. So the biology, they believe that just biology have a role in developing the disease. But later, after the development of the invention of the microscope and the development of in the field of medicine, the scientists reached a belief that yes, the behavior, the social and psychological issue has a great role in developing the disease. As you know, after the beginning of the Renaissance, have you anyone heard about the Renaissance? أستاذ خدماون. ألو ألو
بلا
دكتور
دكتور.
سلمى.
لو ضنك النمع وتم لو أنا لسخنه. Have you anyone heard about the Renaissance?
Yes.
الرينيسانس ده شو الرؤيا طبعا؟
لأوروبا.
very good. طبعا أويك زور بعد سجدة طبعا لميدل ايج سدكاني ناوراس عادة واباو إتلا دواي سدي تواردو بانزو ورده قران كاري طبعا لآرت ولا بميديسن ولا زورشتا الرؤيا زان لأوروباش طبعا كنيسة وأمانة روليكي زوري هبوا لسترجياني خلق إلى الرينسانس هوليانا يعني وردة رولي كنيسة لجياني خلقها كم كانوا طبعا إتلا وردة ديفلوبمنت كان رؤيات اللازور مجالة إيش قلوانا طبعا تشيبو invention of what microscope. Why microscope important? Due to the microscope, they discovered so many microorganisms that cause the illness, and they can do and develop what? Autopsy. Have you heard about the autopsy? What is the autopsy? Have you any idea about the autopsy? Gazni bistuha?
No.
autopsy زور مهم مثلا هينيش ل forensic medicine it is very important autopsy forensic medicine زان چیه اوش تانه بیستو forensic medicine چیه طب عدلي
ما صابتها تشريح وانيا
بلا autopsy زور مهمة كيسك تۆ لە فیلمەکانە بینیوتان لە دوای مردنەکەیەن لێکۆڵینەوەی لەکەن بزانن ڕووداوی هۆکاری مردنەکە چی بوو ئەو ئۆتۆپسیە طبعاً بە ئۆتۆپسی توانیان چی بکەن allow medical practitioner to see the organs that were implicated in different disease بۆی مایکرۆسکۆپی بۆی ئۆتۆپسیەوە سەیریان کرد وای ئەم لیڤەرە بۆ نەخۆشەکەوێت بۆچی نەخۆش کەوتووە تۆ بە مایکرۆسکۆپی سێڵەکانی زیاتر بینی ینی دیزیزەکان زیاتر دۆزرانەوە ئەم هارتە بۆچی نەخۆش کەوتووە بۆچی مردووە تێگەی یعنی لە دوای مردنیان لە ئۆرگانەکانیان کۆڵیوەتەوە باشە سۆ کەواتە مۆدێڵ یەکەم جار فیلدی هێڵت چۆن بووە وتمان biomedical چۆن بوو کەوتمان what is the biomedical is the role of psychology and social matter on the health in the biomedical model no just biology biology so later on there was the rise of what which is the matter and the material of health psychology. The rise of what? The it is very important for the exam. Psychosocial model. Kawata. It has 3 dimensions. It is not just biological. So biopsychosocial, it means that all of these dimensions has role in developing the disease, not just biology. So they stress the importance of what? Considering all these aspects and it is their effect on our health. کەواتە دیفرێنسی ئەبێ بایۆمێدیکەڵ و بایۆسایکۆسۆشیال مۆدڵ بزانن بەتایبەتی لە کاتی مەڵتیپڵ چۆیسە باشە ئێستا وازەحە خۆی تۆزێر فێرست لێکچەر somewhat لەوانەیە تۆزێ difficult to understand لێکچەرەکانی کە خۆشە جا بەتایبەتی کە ئۆنلاینیش بێناڵم وەکو ئینتەراکشنی ناو کلاس نییە now what is the psychosomatic medicine? Any idea about the psychosomatic medicine? Okay. So the psychosomatic medicine is that due to the psychological problem, we have some symptoms on our body, which is not organic one. For example, if you have a depression, you may have the body ache, the muscle ache, the spasm, without having an organic cause for this. You have any rheumatological disease, and you do so many investigation and reveal that you have no biological disease. This is the symptom that you have. This is due to the psychological problem. And this biopsychosocial model, it is not new. even Socrates and Hippocrates, they mention about some symptom that it is not related to the biological problem. It is related to psychological problem. And you know, I think most of you heard about the Sigmund Freud, which is he was a neurologist and psychiatrist. Have you anyone heard about Freud? كستان hiç idea شيء لبالي فرويدو؟ يعني زين توبي بيبو للريال مدريد ابو لسر ختن زوزو خوتان ليك لسر خدماون
بلا
والله
علينا.
دكتور
باش تكون درنگ آنسر كان نوكو خوتان لك
ما
هيك
صح
يعني
هموي لايكي كرد بويا أنسر
عفو والله هو من هنا فول سكرين مقردو لا برشا مش كنت هنا نايبين دستان خوش به بالنسبة هيك idea كي about Sigmund Freud كستان بيستو تانا تايا سالسة Sigmund Freud باش دستان خوش به So the Sigmund Freud proposed that the unconscious psychological factor could contribute to the physical symptom. They discussed and write so many things about our unconscious mind, how unconscious mind has effect on our physical symptoms. Sometimes you don't aware about your unconscious mind, still has effect on your body. And we have another scientist, Walter Cannon. They link emotion to physiological change, showing emotional causes can lead to illness. أنا لينكي ساينتستانه با تيوريكي كان بوا مهمة زور جار ل true false بوتانيتو باشا كواتا والتر كانون discovery چی بوا emotion, our emotion accompanied by what? Physiological change in our body. ئەوەی کە باسمان کرد وتمان ترسێکە دەبێ ئیمۆشنێکە دەبێت تۆ سادنێسێکە دەبێت زۆر جار عینەن دڵە پەلەپەلەکە هەناسە و تۆمە بێ ئەوانە. Okay. And Helen Flander Dunbar contribution here, she linked personality trait ئەوەی کەوتم لە presentation باسی personality trait-ەکان کرد. Some personality has linked to some specific disease. For example, personality type A, they are aggressive people, anger people, they are more liable to get cardiovascular disease than the people who are calm, relaxed. So if you have angry issue, you may are liable to get cardiovascular disease more than the people who are calm. So Helen Flanders linked personality trait to the disease. So another scientist, Franz Alexander, said that the emotional conflict were seen as a precursor to certain disease like the Helen Flander, building on the relationship between emotion and illness. And psychosomatic illness, as I said previously, the specific disease like peptic ulcer, rheumatoid arthritis, and asthma were considered psychosomatic, linking emotional and physical health. So sometimes, due to some psychological problem, you'll get some disease. For example, if you have very stress, so you may get peptic ulcers. And sometimes too much stress may trigger inflammatory reaction in your body, and this inflammatory reaction sometimes causing some immunological diseases like rheumatoid arthritis, like Hashimoto's thyroiditis. Why it will raise some autoantibody that damage your body. So, and nowadays there are so many talk about that the stress and depression, it is independent risk factor for the cardiovascular disease. And even this stress and depression may cause inflammation inside the vessels, inside the heart vessels, and will lead to the cardiovascular disease. And this is the so the psychosomatic, it was a path for developing what the biopsychosocial model. So in the biopsychosocial model, it is a wide model. Try to involve all aspects in developing of the disease. It is not just psychological, not just biological, or not just the social, all three dimensions. So it is more than the psychosomatic medicine. So it is a broad and field. And this is the changing of the field of the health from the biomedical, psychosomatic, and then psychosocial model. Now, another topic of these lectures is why you need and what is the significance of health psychology. Due to the emergence of these, the need and significance of the health psychology appeared. First one, changing pattern of illness. You'll talk about it in a few minutes. Advances in technology and research, expanded healthcare services. وتانا زانن بيشتر healthcare service هل السليماني شابون نبلي منور جرين وكو يستا بيشكوتو نبوا جاران السليماني خسطره نبوا خسخاني تايبت بنخوشي كانسر نبوا چەند خەستەخانەیەکی بچووک هەبووە چەند بنکێکی تەندروستی هەبووە بەڵام بینی ئێستا healthcare service چەند expand بووە هەر لە ناو شاری سلێمانیە چەنەها فیلدی تازە دروست بووە کە پێشتر بۆ نمونە نیورۆلۆجیستمان نەبوو کاتی خۆی کاردۆلۆجیست سپێشەلایزمان نەبوو زۆربەی جێنەرەڵەکان بوون internal medicine بوو general surgery بوو ئێستا سێرەکەی فیلدەکان زۆر فراوان بووە لە بەروی healthcare service فراوان بووە we need a health psychology. And the last one, increased medical acceptance. جاران خەڵک زۆر لەوانەیە باوەڕی بە مێدیکەڵ ئیشۆکان نەبوو بێ زیاتر باوەڕی بە خوراف و بە کۆمەڵێک شت هەبووە خەڵک ئێستا زیاتر تەقەبولی لایەنە مێدیکەڵەکانەکە لەبەر ئەوە پێویستمان بە گرنگی health psychology بۆیە زیاتر دەرەکەوێت. Changing pattern illness. What are the changing pattern of the illness? As we mentioned, most of the people died by what? By acute illness. And the lifespan was short. So the people would not get a age to get a chronic illness. But nowadays, due to the prolongation of the lifespan, there are developing so many chronic illness. Have you any idea about the acute and chronic illness? Anyone? Any difference between these two?
It's something like the illness that is always with us.
Chronic.
Yes.
And acute?
It's disease that come and go.
Come on and
It's
go.
not
Very
stable.
good.
Yes.
Yeah.
Short-term disease like influenza.
Yeah. So in all medicine, you have acute and chronic illnesses. So acute, it is abrupt, sudden, or onset. It's abrupt or sudden is no different. Onset. So you will wake up in the early morning and you feel you have fever, myalgia, and yesterday you had no any symptoms, but now you feel you are sick. You have a sore throat, or you have vomiting, diarrhea. So acute onset. It is abrupt and sudden onset. And what is important, as you mentioned, short course. It will not prolong. It's not for the long term. You'll cure in a few days or even in a week. Maximum, most of the acute illness relieved in 2 to 3 weeks. طبعا the definition كان any acute symptom كان it is different according to the symptom. For example, if you have diarrhea more than 2 weeks, you say it's a chronic one. So if you have a cough for more than 3 weeks, you may say persistent. Or if it is more than 6 or 8 weeks, you say it's chronic. So it is somewhat different. So mostly it is less than a month acute illness. While the chronic illness, it is a prolonged disease, not resolved spontaneously by itself. It needs treatment. It needs intervention. Like what? Can you give me an example about chronic illness?
Diabetes.
Diabetes. What else? What else? Diabetes.
Arthritis.
What?
Arthritis.
Arthritis, yeah. Arthritis is a general term. You have acute arthritis, but if they rheumatoid arthritis, systemic sclerosis, a rheumatological condition. Is there any hypertension? It's very common. Okay, cancer.
Is it related to stress and those things?
Yeah, exactly. You will mention in the next lecture.
Okay.
We'll talk about in the future lecture about this, how stress, how behavior affect our illness. So سلايد كانت هسه كشينيا واضح عمي
بلى.
كشتاني لقى سلايد وشتا. Okay. Now we have this table and it's very important, especially for the exam. You should know the difference between, as you mentioned, this is short duration while chronic is long duration. Acute illness is what? Rapidly progressive, while chronic illness developing slowly. What does it need, acute illness? Urgent, emergency care. While chronic illness, wide array of services and management. You know, just diabetes, look at it. It needs a lot of management. It is not just anti-diabetic. You may need medication for controlling of the lipid. You may need the medication for controlling hypertension, cardiovascular disease, because diabetes is causing so many complications. For example, acute illness, you have tuberculosis, pneumonia, influenza, flu-like illness in general, gastroenteritis, okay, food poisoning, and so many. while the chronic illness, as you mentioned, cancer, diabetes, heart disease, rheumatoid arthritis, and hypertension, some pulmonary disease like pulmonary fibrosis, and so many diseases, okay? Depression, schizophrenia, it has a lot of chronic illnesses, okay? And we have a question. Why have chronic illnesses held the field of health psychology? Why? First, these are diseases in which psychological and social factors have a great role as a cause of these diseases. So that is why chronic illness held the field of health psychology, because psychological and social problem has a great impact in developing chronic illnesses. For example, as we mentioned previously, some personality or some behavior like smoking, smoking causing so many diseases like cardiovascular disease. Cardiovascular mean myocardial infarction, stroke, and peripheral artery disease, and so on. So disease related to the vessels, causing cancers. Which type of cancer mostly smoking cause? The most common cause of this cancer is smoking.
Lung cancer.
Lung cancer, very good. So diet. If you have a bad diet, you become obese, and obesity is a risk factor for hypertension, for diabetes, for obstructive sleep apnea, and so on. Another behavior, some bad sexual activity. It is cause what? AIDS. And I think in the 12th lecture, we'll talk about AIDS in detail. So all of you know how AIDS transmitted from animal to human, and now it is a disease in human, transmitted from one human to another. So by this, the chronic illness help the field of the health psychology. And the second one, chronic illness, you should live with it. So if you have chronic illness for so many years, you may get depression, you may have stress, you may have so many problems. So that's why the health psychologists try to help people to have a chronic illness, to make them to use their treatment in a proper way, to convince them to not avoid their treatment, and to provide a healthy environment for them. Now, the second one in the significance of the and health psychology is advances in technology. We mentioned previously طبعا او يكوتبان بون مايكروسكوب وأمانة وايلي هاكتو شنها disease diagnose بكري اگر ام تكنولوجيا استانه بوايا زوربي كانسر diagnose ناكرا تبروي استو كانسر diagnose كي كواتا خلطك توشي psychological problem بك psychological problem هي بيس health psychologist كواتا significance كي بوي لو advanced لا هنا تنانتو إذا نجا بلا بريس كانسر تايبا كهاني بريس كانسر يجبوي ئەدڤانسی تەکنەلۆجیەوە جیاکرێتەوە. یەک تایپ برێست کانسەرمان نییە، یەک تایپ لەن کانسەرمان نییە. So کەواتە advance in technology and research, by that we will understand the need and significance of the health psychology, why we need the health psychology. As you know, certain treatments that prolong life may severely compromise quality of life. All of you heard that if the patient receive chemotherapy, they may have a lot of side effect, a lot of problem. So it is our job as a health psychologist to convince this patient to get this chemotherapy and tell them, in spite you have this adverse side effect, most of the adverse side effect, you can deal with it. We can be manageable by the specialized doctor. So you should go according to the protocol to get rid from your diseases. As you know, nowadays, so many cancer will get cured, especially most of the hematological cancer and most of the breast cancer, if diagnosed early, the patient may get rid of this disease, colon cancer. So that's why health psychology is important. And the third one, expanded healthcare services. As I mentioned previously, now there are huge expansion in the healthcare services, not like previously. We have now different specialties, different fields. So that's why you need health psychologists to implement and to do study about the disease. You need health psychologists in the university, in the hospital, in most of the health of those systems who provide health cares. And the last one, as we mentioned previously, increased medical acceptance. Increasing acceptance of the health psychologists within the medical community. Previously, as I mentioned, they don't believe in the psychologists. They believe that the disease is related to some superstition, some myth, some strange idea. They don't believe that the smoking causing the diseases. So nowadays, the most people accept some fact about the medicines, that diet or smoking, alcohol, that have a great role in developing so many diseases. So, and by that, the community need health psychology, and the community know the significance and the need of the health psychology. Now, another topic in this lecture is epidemiology. Anybody knows? Can you tell us what is the epidemiology? Any idea? You can speak.
I don't know the meaning of the word, so I don't know what it is.
How many persons till now not heard about epidemiology?
ماسا ئەو زانستەیە کە کاریگەری نەخۆشیەکانە لەسەر کۆمەڵگەکان؟
بەڵێ بەڵێ، ینی ستادی دزیزەکانە، prevalency ستاتستیکی دزیزەکانە کۆزی دزیزەکانە epidemiology is very important. So هەژدە کەستان جوینن وانە؟ هەژدە کەس لێرەیە؟ هەموو چەند کەس
بەڵێ هەژدە کەس
هەژدە
هەژدە
کەسەوەنە؟
خۆ گەشتین تا بیست بەڵام هەندێک کەس دەرچوون
بیستێگە خدە نابێکە دەرچوونان ئەوەیە تۆ زیانی ئۆنلاینیژە من دەقیق خۆ چاومان لەسەری نەکە نییە. باش ئێستا بە ئەم ناوانەی کە لێرە هەیە لای خۆتان بزانم ناوەکانتان بخوێنمەوە لێرەن یارە ئاراس
بەڵێ
تۆقە ویسام
Yes.
گەشبین
بەڵێ کاک دکتۆر.
سەهەند فایب ئەدەرسەکە ئەلین
بەڵێ.
ئەرینا
بەڵێ
ئارۆ
بەڵێ دکتۆر
باسکاڵ
بەڵێ.
گەشبینمان خوێنەوە بزانم وانە بوو
بەڵێ بەڵێ.
لارەش لارە
بەڵێ.
دوو لارەمان هەیە لارا سەڵاح
بەڵێ.
لاڤین
بەڵێ کاک دکتۆر.
لیندا
بەڵێ.
لیڤا لیڤا کۆنێک بوو بەجێش بوو ڕێناس باشە زۆر باشە ڕێناس کێشە دیە دێلی باخە ڕێناس دەنگی نییە ڕێناس نەبوو باش ئێوە نووسیتانە کۆنێکت و کەچی لێرە نین بۆ ناکرێتەوە قەتع نەبووە شاشەکەس دەکەم لایم بلۆگ قەتع نەبووە
No,
نەخێر
but it's our name.
ئەوە ساهین بۆ نازم ئەستم کرد شاشەکە ستۆپ بوو لەکوێ بووین لە ڕێناسا بووین ڕێناز نەبوو جوینی کردو چی داهاتوو ڕۆزە
بەڵێ.
ساندمان خوێنەوە ئازام سارە
بەڵێ
زۆر باشە ساڤە
بەڵێ.
تۆقەمان خوێنەوە ڤانۆ
بەڵێ.
یاراشمان خوێنەوە زین
بەڵێ دکتۆر.
ئەوتەمانی خوێنمانەوە ئازام بەس ڕێناس جوینە و دەنگی نییە وایە ئێستا نەزەم نامەشی نەنا بڵێ چێکتاوەتی کێشەی ڤۆیسەکەم هەیە بەزنامەی نرد ڕێناس لێرە نییە ئەزای چی شتێکی باش نییە بەڕای من ئەنی تۆ لە جوین کەیت و مەشغوڵی شتێکتر بی ئەنی ئێمە جاجار بۆی لە ئۆنلاینە ناچارین چکە ناتان بینین ناچارین جاجار ئەبێ ئەوە بیخوێنینەوە بزانین ئێمە لەبەر هەندێک ئیش و حەز ناکەم بڵێم یعنی هینەکان کامێرەکانتان بکەنەوە بزانین لەوێنە لەوێنین بەڵام ئەوە جاجار ناوەکانە خوێنینەوە بزانین ئایا بە فعلی کە تۆ ناوەکەت جوین بووی بە فعلی لەویای یان نە ئەگەر مشکلەیەکتان هەیە بۆ نمونە ئیشوەیەکت هەیە توانی زووتر ئاگادارمان کەیتەوە ئێکسکیوزێکت هەیە زۆر ئاساییە کە ئەمڕۆ ناتوانانی ئامادەبی بەڵامە بێتتر ئێکسکیوزەکە لۆجیک بێ بەڕاستی چکە لە ئەوە ڕێناسخانەوە ساهێنی کرد باشە لەبەرەوە هەوڵ بن کە جۆی نەبن بمێنەوە لەسەر محازەرەکان چکە لێرا وەکو کوتم ئەو شتانی کە ئیمپۆرتەنتە زۆر جار بۆ ئێگزام بۆ شتێک ئێتە دووبارەی ناکەینەوە ڕاستێکی وازحە کەواتە بە تەماخەمتان نەبێ لێکچەرەکانی کەونە دوور و درێژ نییە بەزەم لێکچەری ئەوڵ ئێستا بینەوە لەسەر هین بووین epidemiology. Okay. Now, epidemiology is what? The study of frequency. يعني نمبري disease frequency. disease شنو بلا ولا مش وينها. Distribution and cause of the infection. كواتا. It is a study of these dimension: frequency, distribution, and cause of disease. Whether it is infectious or non-infectious disease. You know, it is not all disease, as we mentioned previously, it is not all diseases communicable. Some diseases non-communicable, like heart disease and so on. So, in a population, so they study a disease, a frequency of a disease in Sulaimani. How this disease is common in Sulaimani. For example, diabetes. How many percentage of population of Suli have diabetes? How many percentage of Erbil has hypertension? Which disease is common in this city and which disease is common in another city? And if you know this disease is common, and you'll have a question, why this disease is very common in this community? Try to find the answer. If you find the answer, you try to prevent and decrease this disease in this community. So this is the epidemiology. Is it clear? It's very important. Now we have two definitions in epidemiology, which is very important. Which is what? Morbidity and mortality. So the two terms linguistically is so similar. There are some change in some letters. Morbidity, mortality. They have the same rhythm. But in the meaning, there are great differences. So morbidity is what? Number of cases of a disease that exist at some given point in time. So it is the number of cases, not the number of death, morbidity. So number of hypertension in Suli. Number of obesity in Kurdistan. So morbidity is number of cases, number of the disease, while mortality is what? What's the mortality? Any idea?
نسبة مردن لو نخوشية.
نسبة مردن لنخوشية كواتا difference
Those-
واضح.
Those someone who's died and the count number.
Yeah. So
Yes.
so number of these due to the cause and illnesses. So the number of deaths, number of death, mortality by T, number of death. Palamba B, عندي نمبري چییە؟ کەیسەکانە ئەوانەی کە ئەلایڤن. باشە؟ So this is about of epidemiology. And why epidemiology is important in health psychology? So if you know which disease is common in this community, so the health psychology to try to prevent this.
It's like the study that we know the illnesses that it's here.
Yeah. So if a cancer is very common in this community, we should raise a question why this answer is very common, and you link this cancer to the smoking. When you study in the case who have this certain type of cancer, and you reach a point that 70 or 80% of those patients who have a certain cancer, they are smoker. So you say that the risk factor, the smoking is a risk factor for that disease, and try to decrease smoking in this community. Okay, so this is the epidemiology, and it has a great role in health psychology. The last topic, and I think during the lecture we mentioned work of health psychologists. Let's try to mention it again rapidly. So what is the work of health psychologists? Diverse work setting. We have health psychologists work in various environments, as we said, in university, government agency. You know what are the CDC. In Corona area, all of you heard about the CDC, isn't it? Have you heard about the CDC?
ماسا ئەو شوێنانەیە کە نەخۆشیەکان کۆنتڕۆڵەکەن
لەکوێ CDC لەکوێ بوو؟ ئەخرە دەستگای لەکوێ؟ دەستگایکی زۆر گەورەیە CDC لە عالەمە. لەکوێ لە چ وڵاتێکە؟ لە کاتی کۆڕۆناکە زۆرەمان بیست. ئەمریکا. very good. باشە، بۆ نمونە لای خۆمان خەڵک پێڵەکی هەسخانەی شیرەکە، سنتەری پارێزی، ینی لەوێ یەکێکە لەو شوێنانەی ڕۆڵی هێڵ سایکۆلۆجیست هەیە لە یونیڤەرسیتیە وەکووتپان ئەمانە، ینی لە various ئەیجنسیە ئیشەکەن. یەکێکە لەینەکانمان ریسەرچ فۆکس، بەمانەمان هەمی باس کردو تقریبا. clinical role, they have behavioral intervention, we mentioned all, prevention and behavioral changes, teaching and research, وكويسة كمان teaching كمان health psychology. Allied health role, some health psychology students pursue career in allied health professional like social work, occupational therapy, dietitian or public health. کەستان زۆرجار هیچ شتێکا بەشداریتان نەکردو بۆ نمونە هەوڵبن ئیشوێک psychological problemێک هەیە بۆن لە یونیڤەرسیتیە هەوڵبن فیکسیکەن. Public health contribution here, promotion of the health. So on conclusion, this lecture has provided overview of what health psychology. We emphasize on the importance in understanding the psychological, behavioral and social factors that influences our health. And we try to explore the evolution from the biomedical model to which is the matter of our subject and lectures, to the biopsychosocial model. and highlighting the comprehensive approach in health that include biological, psychological, and social dimension in developing the disease. And we mentioned the contribution of psychosomatic medicine, and additionally the role of what epidemiology in health psychology. And finally, we have identified the various work setting and the role of the health psychologists in the community. Thank you, Gina Sir. So, any question? Any question about the health psychology, about the course information, about the course?
بس أحمد كاك دكتور برزنتيشن كان individual
لا باسم كده همي بجروب هم ريبورت وهم دير اوقات انا لسر خدمته هم اسايمنت كانيش هم اسايمنت يكمش كريبورتا هر جروب اسايمنت كما اسايمنت بو معنی جروب به و فيري كوميونيكيشن سكيل بن فيري كوبريشن بن لبروا بجروبين ببلام استاو خوتان بسبنس كسن وانا
بله كاك دكتور
بسبنس كسكا سپێنج کەسەکە وڵای گروپی سێ کەس پێنجی زۆرە بەڕاستی ینی ئیشەکان زۆر کەمە بێتەوە نازانم خۆتان چۆن گروپەکاندانێت چۆنتان داناوە لە دەرزەکانی کە فەرموو ڕێناسان ڕێناس خالی دەستی بەرز کردێتەوە فەرموو نازانم دەستی بەرز کردێتەوە
ماسا ئەوە لە کاتی ناو خوێندنەوەکان بوو دەستی بەرزە کرد
بەڵێ پێسا خۆتان گروپەکانتان لە هینەکانی کە چۆنە
جار هەبووە کە بە کەیفی خۆمان بۆ 2 کەسیان 3 کەسیان 4 کەس هەندێک جار شمەستبی بووە کە ماسا توێتی ئەبێ لە 5 کەس بێ یا لە 4 کەس بێ
باش وڵڵاهی 5 کەسەکە تۆزێ هەستەکەم زۆرە ئەگەر 3 کەسەکە دانێن بەزە و کاتەوە زەمی یەکێکتان ئینە بێ ئەتوان دویە بێ خۆتان چۆن هەم بەدڵە نوێنەرەکە بەشدار نەبوو تان نوێنەرەکەتان چێ بوو
یوسر
جان
نوێنەرەکەمان یوسر بوو بەڵێ
لێرە نییە بزانم ناوکەیم نەبینی
لێرە نییە
لە نوێنەرە با لە پێشەم کەسێکەوە لێرە بە کەستان تا ئێستا ڕجستریشن تا نەکردووە لە مودڵەکە ساینینتان نەکردووە کەسێ لەمانەی کە ئێستا لێرە بێ مشکلی لە مودڵەکە هەبێ ڕجستریشنتان تاوا نەکرد بێ دیارە کەس نییە هەمووتان یانی پێرفێکتە باش بزانین هەوڵێم
دکتۆر بێ زەحمەت پرسیارێ لەم بەرنامەیە لەم لایفانەی کە ئێستا ئەی خوێنین شاشە تەسجیل ئەکرێ یان سەوت تەسجیل ئەکرێ ئەگەر تەسجیل بکرێ بتوان بۆمانی بنێرین زۆر سپاسگوزارە بین
من ئەخردی لێکچەرەکەم پێشتر ڕیکۆرد کردووە
ئەزانم لێکچەرەکە پێشتر ڕیکۆرد کردووە گوێشم لێی گرت بەڵام لێرە مەسەلەن دزیسەکان کە ئەتوت نمونونەکان کە ئەوترا لەناو ئەو ڤۆیسیان نەبوو ئەو ڤیدیۆیی نەبوو کە کردتە
ڕاستەکەی ئەمڕۆ ڕیکۆردم نەکرد ڕاستەکەی بەس لەوانەی کە هەوڵێن ڕیکۆردیکەین خەیاڵم نەبوو ڕاستەکەی بەس توانین لەوانەی کە ڕیکۆردیکەین ئینشەڵا یەکێکە ناوەکانە خوێنینەوە و ئەتێندانسەکە هینەکەین باشە زانین هەمووی 25ەکەی تایە لاڤین
بەڵێ کاک دکتۆر
ئەمە پرێزنت یوسر ئەوتان ئەبسنتە ئارینە هەبوو وانە
بەڵێ
بڵێن بەڵێ بۆیە بزانم تا یاسە لە سەخەتن یارە
بەڵێ
کەستان ڕیکۆردان نەکرد لێکچەرەکە ڕیکۆردی کردووە زۆر چاکە دوای ئەتوانی بۆم بنێری بەینێک بێ خۆم لە مطلقە دایانێمەوە باشە یا خۆ لە گروپەکە بینێری بۆ جەماعەت لەوانی کە هەوڵێنی نیگەین باشە دەستان خۆش بێ لیندا ئازاد لیندا ئەبسنتەوە نیە جان
بەڵێ دکتۆر
ئێتەوە ئەمیکە لارە هەبوو کاتە
دکتۆر ئەتوانی لاراکان ناوی باوکیان خوێنیتەوە چکە من ئێستا
لارە ڕاستەکەی لارە بەڵێن لارا بەڵێن نازم بەڵێن نووسراوە لای من بلێن یا بەڵێن ئەو داواستەکەم خەڵەت نووسراوە بەس ئەوە محاولەکە نازانم بە کاتی خۆی کە ڕێجستریشن تا کردەوە و وەستەکەم خەڵەتە بلێن نووسراوە لای من لای خۆشی وایە تەسەورەکەم ئێستا لارا بەڵێن لێرەیە لێرە ماوە لارا بەڵێن
لێرە نییە وەڵا
لێرە نییە باشە لیڤا لێرە بوو
بەڵێ دکتۆر
ئەلینیش لێرە بوو
بەڵێ
ڕێگا وەزم لێرە نییە ڕێگا ئەو ئەبسنتێکمان بۆ خۆی هین کرد فەقیرە ئەمە ڕێگە لارا غەریب
بەڵێ
زین
بەڵێ دکتۆر
محەممەد ئیسماعیل کاکە حەما لێرە نییە بەخۆز
دکتۆرانە تەلەبەی ڕێیتێکن ئەبەی لینکەکەیان بەجیا بۆ دانێ بۆی بتوانن بێنە ناو دەرسەکەەوە ئەگینا ناکرێتەوە لایەن
نابێت ئێمە لە مودڵەکەی دایانێن ئەوەی کە ڕێجستریشنی کردبێ ببێتە ناو دەستەکەەوە تیان نەوتی شتێکی ویان پێ نەوتیم بۆ ڕێتێک لە فاکەڵتی شتێکیان نەوت و دوایی بە منشێنەش کۆردینێتەرەکە ئاگادارەکەم بزانام شتێکی وا هەیە باسکاڵ لێرە بوو
بەڵێ
سەوگەند لێرە نەبوو سەوگەند جەلال قادر غیابە سەوگەند
کاک دکتۆر ئەوش لێرە نییە
لێرە نییە گەشبین لێرە بوو
بەڵێ
ڕێناس هەر لێرە بوو ڕێناسی لێوەنە بەڵێەوە بکەوت کێشی گوێزمێ نەوە لێرە نییە وەزان نەوە باوغای بگەین شەهد شهد لێرەیە سارا لێرەیە
بەڵێ
ڕۆزە
بەڵێ
عەلی لارا سەلاح لێرە بوو
بەڵێ
سارا سامان
بەڵێ
سادیەش لێرە بوو
بەڵێ
سەهەند ڤانۆ
بەڵێ دکتۆر
تۆقەش لێرە بوو ئاکتیڤیتی هەبوو لە ئارۆ
بەڵێ دکتۆر
کاکە ئەمە سەی باشۆ نەکس پێیج و کەسێ بڵێ نایم نەخوێن بێتەوە و بیرم چوو بێ هەمووتانم خوێنێتەوە زۆر باشە ئینشەڵا هەفتەی داهاتوو هیچ کێشە نەبێ بەشکەم بچینەوە کامپەس و یەکترێ بینینەوە خۆشحاڵ بووم کاتێکی خۆش خواتان لەگەڵ